first week as governor, Mike Braun's administration has made an immediate goal to get people off Medicaid. That's publicly funded health insurance for people with low incomes. One of the state's first strategies, it seems, is to stop telling people about their benefits, a move which could hit communities of color hardest.
Effective upon Governor Braun's inauguration, we stopped advertising for Medicaid.
Governor Mike Braun's new head of the Family and Social Services Administration, Mitch Rube, told a state appropriations committee that to limit enrollments, he's ordered an end to all advertising for Medicaid programs on radio and television in Indiana.
And we will further constrain Medicaid eligibility across all pieces, across all the different categories of eligibility.
According to the Indiana Medicaid enrollment dashboard, Black and Hispanic or Latino Hoosiers are more likely to rely on Medicaid. It's why Shirley Toro of the National Black Leadership Commission on Health says attempts to limit access to Medicaid are a direct attack on communities of color.
The thing that immediately comes to mind is, well, this tactic or the strategy is being used because it's a way to keep people, in the dark and keep people misinformed about what their levels of access actually is.
The Indianapolis NAACP chapter telling News 8 in a statement, Medicaid is a critical lifeline for many Hoosiers, particularly in marginalized communities. Restricting information about Medicaid benefits undermines public health and equity.
It's actually shocking that your governor would think this would be a way to save money.
Dr. Jane Delgado of the National Alliance for Hispanic Health says in a state like Indiana, where more than 1 in 4 people rely on some form of Medicaid, the impacts will be felt in every community.
I mean, do you really think that the Hoosiers are people who are not going to find out about it one way or another? I mean, it's really a slap in the face to the people of Indiana.
When our governments question why communities of color, why underserved communities have high levels of mistrust, I'm going back to that mistrust again. This is why, right? Because this is a very insidious way to cut people's access to resources that we know they need.
You may be wondering what Governor Mike Braun has to say about this policy change. We have the same questions. I've reached out multiple times to the governor's office and the FSSA for an interview or explanation about their methods to reduce Medicaid enrollment. So far, no response.